past. Oh,
so did we lose her?
Lose her.
She was trying to say she's the program director and she welcomes everyone. I will check if she can get back on. Let's see. Well, I'm Sonia, I'm the PGY5 and I'm the chief. And we voted for this position. I am the one and only PGY5, so I'm very appreciative of everybody who voted for me. No, but we're excited to have everybody here for the open house. We're just going to do a little bit of overview of the program, and the faculty is going to talk a little bit, and then probably around 8:30 we'll do just kind of the residents and everybody by ourselves, just talking, and the faculty will get off and we can just talk amongst ourselves. So in the meantime, we will check and see where Dr. Shiloh went.
She's back.
Yes.
Oh, okay, perfect.
Sorry about that. I don't know what happened. So welcome again. And maybe we'll start just with introduction, who's here on the call. So I don't know when I was cut off, but I'm the program director. Faculty, my subspecialty is epilepsy. So this is my clinical practice is both general child neurology and also epilepsy. I'll let other introduce themselves.
I'll introduce myself. My name is Diana Sejas. My pronouns are she, her, hers. I'm an assistant professor here at UNC, so I'm junior faculty. And I am, just for in case those of y'all are interested, I'm going to be live tweeting tonight. We'll also have a recording of at least the first part of this available for y'all so that you can view them later. Welcome. Oh, and my specialty, geez. I'm interested in neurodevelopment. I am a mess. It's nice to meet y'all tonight.
I'll go next. Hi, everyone. My name is JoJo Young. I'm a Peds epilepsy specialist here, also faculty, and I just lost my voice, so I apologize. It doesn't usually sound like this.
I'll take over for one of us will go. Take over for JoJo since I do have a voice right now. Oh, sorry, JoJo. I'm Sienna Hunter. I also I'm a peds epileptologist. That's my specialty. I'm interested in neurogenetics, and that's what I do for research. I spend half the time doing research and the other half in clinical care. I am an assistant professor here as well.
I'll go. I'm Jamie Capel.
I'm Katie Olm-Shipman.
Oh.
And
Casey, go ahead.
oh my goodness, I am in a place that has horrible Wi-Fi, so hopefully this message will get across. But I am neurocritical care and pediatric faculty, and very excited that you are checking out our program.
Hi, I'm Jamie Capel. I'm an associate professor here at UNC. I'm a child neurologist and neurodevelopmental disability specialist. I do research in rare diseases and neurocutaneous disorders, and do some clinical care in those populations as well. And welcome, everybody.
I think that's it for the faculty that I see on here. I'm Nate Wooden. I'm the PGY4 Peds Neuro resident. Nice to see all of you here. Thanks for coming.
Hey, I'm Luke Quell. I'm the PGY3 Peds Neuro resident. Good to meet you.
Hey, I'm I'm Michaela Squire. I'm one of the PGY2 residents.
I think Stephen probably stepped away, but he's the PGY2, Stephen Papas. And I'm the PGY5, Sonia. I think I met you earlier. That should be all of us. There's 2 PGY1s. They couldn't be with us today, but they are Holly and Stacy. So.
All right, so we'll start with, we have some information, a PowerPoint to kind of run through the main elements of the program. I also want all of you guys to feel free to email any one of us with questions if you have specific fields that you're interested in, specific items that you want to ask. Obviously, during this session, but also afterwards, feel free to email or ask any questions. So I'll let Sonia share the general information about the program.
All right. Okay. Can everybody see my screen?
Yep.
Okay. Let me. Whoa. Okay, I don't think that worked. It's just a black screen. Sorry about that. I try to get fancy and have 2 screens, 2 monitors, so that's what's going on here, but okay. Does that look okay now? Do you see the actual PowerPoint?
We're seeing kind of the presenter view,
Okay.
so we see multiple slides.
All right, almost there. You would think by now I would have this during COVID, but let's see, here we go. It disappeared. 1 second. Here's what I'm gonna do. We might just have to do it this way.
Do you want me to share it?
You try hitting the swap displays button.
Oh, that's smart. Try to get there again.
It's on the top of their screen. Yeah. There you go.
See, that's why we have Dr. Young. She always fixes everything for us. Okay, so that should be better.
Yes.
All right, so we're just gonna kind of go through a little bit of the leadership, and then we'll go and talk about how the years are broken down. So leadership wise, Dr. Lee, she's not with us on our open house, but Dr. Lee, she's our Chief of Pediatric Neurology. Dr. Shiloh, who you met, she's our Program Director. Dr. Meg Kilstrom, she's our Pediatric Program Director. Might have to talk about them the entire time because it's not, there we go. Epilepsy faculty. So we have 4 great epileptologists who are with us. Dr. Shiloh and Dr. Lee, we talked about them the last slide, but they are kind of starting with Dr. Shiloh. She is our program director, as well as she's also the associate program director of the Epilepsy Fellowship. Dr. Shiloh and Dr. Hunter also are working on a Neurogenetics Initiative, which is brand new. I believe last year was the year it started, or maybe 2 years ago. And then Dr. Lee, she is also one of the epileptologists. Dr. Hunter and Dr. Yang, they are both assistant professors, and they joined us probably a year ago. Dr. Hunter was my chief resident when I first started, so really glad to have her back with us. And Dr. Yang is the director of the Pediatric Epilepsy Monitoring Unit. Her and Dr. Hunter have really helped us kind of, update the pediatric EMU unit and making sure that patients are, getting the best treatment possible. So very glad to have them with us, and all 4 of them are great teachers. And that's going to be a theme with all of our faculty. So starting with Dr. Fan, she is pretty much a specialist in so many different things: neuromuscular, sleep, as well as genetics. So she is she's actually my mentor. So very happy to have her as my mentor. Dr. Gershon, he does a lot of research, and his main interests are neurobiology of cerebellar development and medulloblastoma. He's actually one of our pediatric neuro-oncology specialists. And Dr. Greenwood, he was a previous program director before Dr. Shiloh, I believe, and he is still, working hard with us, and a lot of research interest, but the main one is neurofibromatosis. You'll still see his adult patients coming in to see him in clinic. Dr. Trow, he is our assistant professor in child neurology. He has an interest in tic disorders, and actually has a clinic that he's trying to get a multidisciplinary clinic put together for Tourette's. So it's pretty much in the works, and because of COVID, things have kind of slowed down, but I think probably within this next year, we'll have more things together. But it's really very interesting how his clinic is run. And he's also interested in status epilepticus management. And Dr. Shipman, she's a pediatric neurologist, but she does spend a lot of time on the adult neurology side. And we're very lucky to have her join us on the pediatric neurology side as well. One of her interests is quality improvement. So if you have any projects or interests, she's the person to go to, and she'll help you kind of go through the whole process. Neurodevelopmental specialist. So Dr. Kappel and Dr. Sejas, you get to meet both of them today. And Dr. Kappel, everybody has a lot of different interests and different research interests. So it's hard to keep a list of everything in this little box, but both Dr. Kappel and Sejas, they work in CIDD, which is the Carolina Institute of Developmental Disabilities, as well as UNC, which is a very unique opportunity for us as residents. And so she has interest in tuberous sclerosis and NF1, autism spectrum disorder, and behavioral challenges associated with neurodevelopmental conditions. She's involved with several different research projects that are ongoing. Dr. Sejas, she has a dual appointment with the CIDD, and her interests are healthcare transitions, health equity, patient advocacy for young adults with disabilities. And here are your residents. So you met all of us, PGY 4 or 5, and 5, 4, and 3. Luke is in his 3rd year, so he's doing a lot of his adult side right now. So we don't get to see him as much, but he's doing great. As you can see, he's with us today. Michaela and Steven, they're in PGY 2. They made PGY 1 year seem super easy, so I'm a little jealous. And then Stacy and Holly, there are PGY 1s. Residency coordinators, we work mostly. Yeah.
Oh, sorry to cut you. If you, I just want to mention we expanded the program a couple of years ago, so it's very exciting for us that your residency year, when you get to your clinical years, you'll with child neurology, we'll have a full program with 2 residents a year. The adult residency program also expanded in the last few years. So, and there are already 7 residents are recruited every year. So we're kind of excited to have a much larger program, which allows a lot more flexibility when it comes to taking elective time and just coordinating everyone's schedule. So it's kind of this photo is very happy for us to see how we're progressing and expanding the program.
Thanks for mentioning that. Yeah, let's see. All right, so the residency coordinators, Ashley is our coordinator that we usually work closely with, and then Sharon Ward works with the adult neurology side as well as a little bit with the pediatric neurology side. And then quickly kind of going over our training and what it looks like. We won't go into too much detail, but just to kind of give a little outline. So your PGY 1 and 2 years, it's general pediatric training. And so you're going to have pediatric ICU, the neonatal ICU, other inpatient months, kind of basically your pediatric training kind of crammed into 2 years. And UNC does such a great job with making sure that you get training in every aspect of pediatrics that you really need to know. The things you might be missing out on are just elective time, which if you like pediatric neurology, your elective time, your 3, 4, and 5 years can be spent on neurology. So I think I really appreciated my first 2 years of pediatrics. And then also your first 2 years, it's not just pediatric, you do start seeing pediatric neurology in clinic. So you get probably one or two clinics a month, just to kind of open, just kind of see patients, nothing too difficult, but just kind of getting your feet wet in pediatric neurology. So, and then PGY year 3 here, this is where Luke is right now. And we'll go into detail about how it's broken up, but mainly it's your adult neurology year. And then 4 and 5, it's all pediatric neurology with a little bit of adult neurology outpatient. And then, so PGY 3, we do 6 months of adult neurology inpatient, and all of the inpatient months are going to be done in that 3rd year. So all your stroke codes and your inpatient adult neurology will all be done in your 3rd year. So once you move on to 4th and 5th year, you don't have to worry about it anymore. But you do get still 2 months of pediatric neurology. So your 3rd year, it's not like you're going to be consumed with just adult neurology. And I found that as very useful for me in learning and also kind of continuing what I enjoy, which is pediatric neurology. And then you get 4-month elective time. You can do peds. We recommend doing more adult, but you can also do peds electives as well. And then 4 and 5, you do pediatric neurology inpatient as well as outpatient. And it's more of you kind of figuring out, is there something I'm really interested in pediatric neurology that I want to get more experience in? Is it neuromuscular? Is it neurodevelopment? So the really good thing about our residency is you can kind of tailor your last 2 years to what you're really interested in. Then education, there's a lot of educational opportunities. daily afternoon lectures with adult neurology. They also started a morning report as well. We have weekly pediatric neurology conferences. And these conferences, we typically present a case. It's usually a kind of a diagnostic dilemma. And we work through this with all of our pediatric neurologists in our department. So very useful, really good learning experience. We have pediatric neurology specific lectures and board reviews that are done weekly. The attendings, we'll have one of the attendings join us for that specific, let's say a Thursday or Friday, and they'll go through the questions with us, or they'll kind of talk to us about a specific topic. Monthly QI lectures, weekly neurology grand rounds. Then you have all kinds of different subspecialty conferences that you can attend whenever you have time. Then the pediatric neurology inpatient service. So for our inpatient service, it's actually a consult service, and even for the EMU admissions. And there's going to be, for right now, and our program's growing, so this is great. But right now we have 2 residents that are on the service at a time. It could be a combination of the adult neurology residents with a pediatric neurology resident, or 2 pediatric neurology residents. So it just fluctuates depending on the schedule. And so call, and everybody's going to be concerned about call. So, so call is split equally among both of the residents. And the interesting thing is, for us, when we're not on service, we don't have call days. So it's not like we split up, 10 call days over a month, anything like that. It's when you're on service, you have call days, but when you're off service, you do not have call days, which is, I think, a pro for us. And this slide, and it's funny because we've kept this for several years, but it really hasn't changed. Why do we love North Carolina? You have the mountains in Asheville, but you can also go to the beach. Everything is drivable distance. You have UNC Tar Heels, you can go to the football games, basketball games. So there's just a lot to do in North Carolina. Also, different opportunities. Our attendings are very, they advocate for us, and they're very encouraging for us to do research projects and teaching and things like that. So anything that you're interested in, if you just talk to the attendings about it, I'm sure there's going to be several that are going to be on your side advocating for you to move forward with that. And this is also an old picture. This is Jordan. He was a PGY 5 when I was a 3. He's actually going to be joining us as faculty. Dr. Greenwood, Nate, and Caitlin is going to be a sleep doctor next year at UNC. She's in fellowship right now. And here's Luke here. See, he's happy. He's still happy. All right. Let me see if I can stop the share.
Thanks, Sonia. I guess we'll open maybe to if people have questions in the next few minutes until we kind of the faculty will break off and you'll get the residents all for yourselves. So if no one has a specific question, maybe one thing that we're frequently asked about is the CIDD, the Carolina Institute of Developmental Disability. So maybe I'll let Diana and Dr. Sejas and Dr. Kappel share some of that and some opportunities with that, because that's kind of a unique opportunity for people training with our program.
Sure, I can talk a little bit about CIDD. So yes, it's the Carolina Institute for Developmental Disabilities, and it is a center on campus that is really dedicated to providing education, both clinical education, research, and then clinical services to people with neurodevelopmental disabilities across the lifespan. There, as far as clinical opportunities are concerned, for our neurology clinics, so Dr. Capel and I both have pediatric neurology clinics where we see patients, almost all of whom have some known neurodevelopmental or neurogenetic condition. And we see them for various neurological issues in our general kind of neurology clinics there. But we also, one of the biggest strengths clinically about CIDD is the fact that there are so many team clinics. Dr. Capel and I are also both involved with the Neurogenetics Clinic at CIDD, where we have a psychologist that works with us, and that's a psychologist who has expertise in working with people with neurodevelopmental disabilities, a speech language pathologist. Oftentimes we'll have trainees from those disciplines who will join us in that clinic. And then sometimes in the past, we've also had psychiatry involved in that particular clinic. And then sometimes also some parent navigators with genetic expertise that will be involved in that clinic as well. So that's something that our residents get to kind of spend some time with. We have other multidisciplinary clinics at the CIDD, one being our Angelman's and Duke 15 and Prader-Willi clinics. So you really get some nice exposure to some of the chromosome 15 conditions. There are also some general, I guess, autism assessment clinics that are preschool, school-aged, and adult autism assessment clinics. Those clinics are mostly run by our neuropsychologists, and also have things like our physical therapists, or not so much PT as much anymore, but occupational therapy, speech therapy, social work is involved in those team clinics, and you really get to see how we do team-based assessments. And sometimes, you know, Dr. Capel and I will kind of be involved with those clinical activities as well. But it's really about like identifying people with specific kinds of neurodevelopmental conditions and then figuring out a multidisciplinary treatment plan for them. In addition to that, they also have our psychiatrist, Dr. Rob Christian, and our psychiatric nurse practitioner, Michelle Franklin, both of whom have expertise in working with people with neurodevelopmental disabilities across the lifespan. And our residents get to spend a little bit of time with them, seeing how some of these people with more complex neurological and psychiatric conditions are kind of co-managed by all of us. So you really get to do a lot of different things just by coming to the CIDD for some of your clinical activities. CIDD also has lots of research going on. I know Dr. Capel is doing a lot of big things over there. Just got a wonderful grant. I cannot help but brag about that. So that was wonderful. And I'm also doing some smaller research that's more qualitative in nature, but all kinds of different studies that are going on at CIDD. If you are interested in neurodevelopment, you can get involved in those kinds of things there. And then of course we have our training that's available at CIDD. It is the home to the North Carolina LEND program, which is the Leadership Education in Related Neurodevelopmental and Related Disabilities program. Highly recommend anybody who might be interested in neurodevelopment to get involved with your LEND program. I'm a LEND graduate, although not of this particular program. I trained in Illinois. So yeah, lots of different things available at CIDD. I don't know if there was anything, Dr. Capel, you wanted to add, but we'd be happy to have you come out.
I think you covered it, Diane. Thank you.
There's a
Looks
couple
like there was
questions.
something in the chat about the
Yeah.
Neurogenetics Initiative.
Yeah, and the deadline for application.
Yeah, so I don't think that we have a deadline for application. We are now actively scheduling interviews, but yeah, I don't think that there's a deadline. We have two dates in November. For the first interview date is early November, and then we go until the first week of January. So kind of, and we decided this year to have a few interview days and have up to 9 to 10 people interviewing in the same day. So kind of a few days, but multiple people interviewing in the same day. For the Epilepsy Neurogenetic Initiative, maybe I'll let Dr. Hunter share that, and I'll also put in the chat our site. So if you want to take a look at the Neurogenetic Initiative site.
And so that's a multidisciplinary initiative of sorts. That there's a clinical realm where we will use the resources at our disposal to try to understand the genetic cause of epilepsy. We have a great group of both clinical and laboratory genetic counselors that help us resolve our genetic epilepsies and then explain that to our patients. And we already have meetings of neurologists, geneticists, and genetic counselors. We get together, we take these difficult cases, and then we begin to try to understand the genetics. Many of us have gotten these genetic results back and we don't really know what applies to our patients and what does not. And so that group, we begin to try to resolve these difficult cases, and so that we can apply that to patients. And the ultimate goal is to see how we can further treatment, how we can improve the care of our patient. In addition to that, we have a research course. So at UNC, there is a big neuroscience network, and we want to bring that to the bedside. And so we work with the bench researchers to see what type of research will be available for our patients. So currently we have novel sequencing that we're offering to our patients. And then we'll also have some different type of research that we're looking at the social determinants of health and seeing how that applies to our patients with epilepsy. We're doing that both at UNC, and then we're also collaborating with other institutions, with WashU and with researchers at Columbia who have similar questions to understand what directs our patient care, what directs our evaluation of patients with epilepsy. So the initiative is really trying to look at a holistic view of both evaluation and management of our patients with epilepsy.
I see that Abiodan, I don't know if I said your name correctly, you can correct me, but you have a question about filters. I'm not sure what you're asking, if this is related to scheduling interviews. I will say I was actually on vacation until this morning. So last I checked, we didn't have anyone yet scheduled for interviews. So if you applied and you weren't scheduled, I don't feel like you're left behind. We're just this week starting to schedule.
I'm not sure, but maybe the filters are about, is there anything that we would not want to, yes, cutoffs regarding scores. That's that's one of the filters. I think Waleed had mentioned. How about international grads? So just for example, I went to a school in Antigua, so I'm a Caribbean graduate. So from my experience, you know, the faculty really looks at your application. And I'll let Dr. Shallow talk about if there's any kind of like other filters, but and when it comes to scores, I'm not sure if there's any cutoffs.
Yeah, I'm also a foreign graduate. My med school is in Tel Aviv, Israel. So, and I was also trained at UNC. So, being a foreign graduate is not a filter. We don't have a clear cutoff as far as the steps. We do get concerned if people fail. So that, but we don't have clear-cut rules that can't be overcome by, you know, other elements of your application. If you have a specific question, if you didn't get a call to schedule an interview, feel free to email me and to request if there are specific things you want me to review.
There's questions about a formal mentorship program for the residents and transitioning from pediatrics to the child neurology years.
So we have assigned faculty mentor for each one of the residents starting in PGY1. And this is part of trying to keep people in touch with our program. Also, the clinics that Sonia kind of briefly mentioned, we have PGY1 and 2 do child neurology clinics. We find that this is very helpful for residents to get kind of this early contact with neurology. Also, one of the things that we hear a lot is that when you come to the pediatric floor, you're the child neurology pediatric resident. So people tend to ask you, and I see Luke is kind of nodding, yeah. So it kind of gives you, hey, how do you do a workup for autism, for developmental? So it gives you kind of more strength and feeling early on comfortable with that. And then the transition from the pediatric year to the adult neurology, I'll let one of the residents answer, because I think that they'll be the best to give this information.
I'm happy to take that one, Sonia, if you want. So for the transition from your pediatric years to your third year, I think our program does a really good job, both for child neurology and for adult neurology residents. We have a boot camp that runs over the course of about 2 months in July and August of your PGY 3 years of peds neuro resident, PGY 2 years adult the adult neurology residents. And every day there's specific lectures by the different faculty. I'm talking about neurologic emergencies and kind of neuroimaging and what you need to know most acutely, importantly, as you transition into the neurology role. And then over the course of those 2 months, they kind of get into other subspecialty lectures. That way, by the end of those first 2 months, you feel like you have a good base knowledge of neurology as you're either in this kind of more fellow role on the pediatric side or on the adult neuro side as you're kind of going and seeing these adult consults. You feel better prepared to answer these questions. And I felt like that having that kind of structure of those 2 months of lectures really gets you up to speed very quickly. Also, when you're on the adult side, starting out, they do buddy call, buddy code stroke. So when you go to any type of like emergency consults on the adult side to start out with, the first week or so, it's kind of a see one, do one, teach one situation where you kind of go with one of the higher level residents and they'll do code strokes for you. And you kind of watch. The next one you do while they're kind of viewing, and then you kind of start running them on your own. And I think the support really helps in that transition period at that point.
There's a question about elements that we are looking for when selecting residents and the kind of culture we wish to build.
So I always say that, and I think that residents would agree. One of the strengths, starting with pediatrics, the strength of UNC is a real culture of teamwork, of support. The pediatrics program is one of the top nationwide highly ranked program. And one of the things that over the years I find remarkable about this program is that when they pick residents, they very much look for people that will work well on the team. And I think that year after year, they have just a wonderful group of people that are really support each other. Residency is hard, no matter what you do. Residency is hard. So at least knowing that you have a group of people that is there for you. We're very fortunate. I'm sure you'll see in the next few minutes when we step off that our residents are a very tight group of wonderful people, and we're just lucky to have each and every one of them are just wonderful. So I think that this is one of the top things we look for, and then obviously someone who's interested in the field, who's interested in learning in child neurology, and you guys are all here, so I'm sure this is not a tough thing to ask. All right, are there any more questions? I'm not sure that I'm seeing. So if there are no additional questions, maybe the faculty, maybe we can step off the Zoom and let you guys hang out with the residents. But anyone has any more questions, happy to answer here, or you can
I think there was one question in the chat about contact information.
All right, I'll put it in. All right, thank you, everyone.
Okay, bye, everyone.